I am Dr. Rita Bakshi, Chairperson of International Fertility Center situated in Green Park, Delhi. I have been in this field of fertility for the last 18 years. I have been dealing with men and women who want to conceive. Let me talk of semen analysis today. Yes, when a couple wants to conceive, I always ask both the man and the woman to come to the OPD. And I always tell that for man, it is very easy because he has only one single test to do, and which is semen analysis. Come to think of it, it's not surprising for many men not to want to get the test done. They think that they are producing semen and it is a good enough predictor of fertility. But to tell you the truth, there are many men who have semen, but they may not have any sperms, or in other words, what we call Azoospermia, no sperms in the ejaculate. So I would request all men to have this test, their role in the field of fertility. For example, how the test can be done is that they have abstinence or they do not consummate or masturbate for 3 to 5 days. Minimum 3 and maximum 5 days. When they do not masturbate, do not have sex, then they should take a clean container with a wide mouth in which they can ejaculate with masturbation. It is important that the semen should reach the lab within 1 hour of ejaculation. When the ejaculation happens, it is mandatory that it is done, maybe possibly by masturbation in the lab itself, close to the lab, or if it is done at home, it is not to be kept in the refrigerator or heated. It should be close to the body at body temperature. And it should reach the lab within 1 hour. Once it is there, the semen is left for coagulation and for the coagulating to liquefy. Within an hour to 45 minutes, it liquefies, and then it is tested for 3 parameters: concentration, motility, and morphology. Now, the concentration, the WHO parameters have now changed, and now anything more than 15 million is good enough count. Any motility which is more than 30% is good enough, and a morphology of 4% is good enough. So, but it is very important that these parameters are met. In case they are not, then one does suspect either infection, which one can treat it with antibiotics and then retest. It takes about 3 months for another sperm cycle to start. So give a gap of 3 months, repeat the sperm semen analysis and check for the sperm or the semen quality. Well, there are men who have Azoospermia and no sperms at all. In those cases, we have to find out whether because it is because of some obstruction that there is no sperm, or is it a non-obstructive Azoospermia. In case there is an obstruction, then one can work out on the obstruction, or one can just put in a needle in the testes or the epididymis and take out the sperms from there. In case it is non-obstructive Azoospermia, one has to see whether the test is atrophic, how is the testosterone amount, and look at it. Just one last word on testosterone injection, which many people in the gym and the gym trainers give. The testosterone injections and steroid injections cause a severe depression in the sperm count, and there are many very good looking sturdy boys who have no sperms just because they have been on these injectables for a long time. So my only advice is that stay away from these injections, look at the semen analysis and work on it. Thank you so much.